the official podcast of the UC Davis Comprehensive Cancer Center. Thanks for joining us today as we have in-depth discussions of the science, research, and advancements taking place at our National Cancer Institute designated Comprehensive Cancer Center. I'm Chris Joyce.
And I'm Stephanie Wynn. We'll also examine proactive approaches to cancer prevention. And most importantly, how we are breaking barriers to beat cancer in our community and beyond. Today, we're talking about global oncology with Dr. Elysia Alvarez and Dr. Cameron Gaskill. Thanks to both of you for joining us today. Dr. Alvarez is a pediatric hematologist oncologist with a special interest and expertise in adolescent and young adult patients with solid tumors. She also co-leads the Pediatric, Adolescent, and Young Adult Comprehensive Sarcoma Clinic at the Cancer Center. Dr. Alvarez's research focuses on factors that impact health outcomes in adolescent and young patients with cancer both in the United States and globally.
And Dr. Gaskill is fellowship trained and board certified in complex general surgical oncology, specializing in the treatment of patients with cancers of the liver, pancreas, and stomach. He has a special clinical interest and expertise in complex surgical care, surgical innovation, and robotic techniques. Dr. Gaskill also has extensive experience in global and public health, building programs to increase capacity in the screening, diagnosis, and treatment of cancers through cancer registries, training programs, and international advocacy. Apropos for today's discussion, Dr. Gaskill is the director of the UC Davis Center for Global Surgery, and his mission is to improve and promote collaboration and innovation in providing care to surgery patients in undersourced environments.
Again, great to have you both with us today.
What does global oncology mean? What is it? Why is it important?
Global oncology, to me, I think it's a lot about partnerships, building those partnerships globally with other countries, other institutions, with providers, and really learning from each other. It really isn't just a one way of us going in and saying this is how we think things should be done, but really learning how it is that we can help each other and learn from each other. Sacramento is one of the most diverse cities in the world. We have immigrant populations from all over, which makes it a very rich and wonderful place to live and practice. And I think there's so much that we can learn here from our patients, and then also learn from our partners globally to help improve care for our patients here, not just those patients abroad.
Excellent.
Yeah, we'd say, why is global oncology is important? Because, cancer isn't just occurring within the high-income countries. There's studies that say the global cancer burden is expected to be over 28 million cases by 2040. So, 47% rise from 2020. And most of that is happening in low and middle income countries. And so, we need to find efforts to build sustainable infrastructure for dissemination of preventative measures and cancer care in these areas that will become critical to improve the health of our world.
And I think often when we think of low and middle income countries or other places outside of the U.S., I think a lot of times we think about like infection and different diseases like malaria, but really our data is showing that cancer is surpassing a lot of these communicable diseases as a leading cause of death. In our work in adolescents and young adults, I know this is a distinct population, but we're showing it as the fourth leading cause of death globally.
Wow.
And so that's huge. And I just don't think it's something that people have really been thinking about. And so helping to build capacity within these countries is part of one of our goals.
Tell us where this interest in global oncology came from and where you'd like to see it go. Dr. Alvarez?
My interest in global oncology started in medical school. I was at the University of California, Irvine, and I participated in a program called the Program in Medical Education, or the PRIME program for the Latino community. It was one of the first PRIME programs within California. UC Davis has a PRIME program for the rural community, and each different UC has one for different demographics of patients. And so as part of this, we went to Mexico prior to starting medical school and did all of our curriculum as much as possible in Spanish. My family is also from Mexico, so that's where a lot of my interest stems. And I just saw the different barriers to care that a lot of immigrants faced when receiving care here within the United States, just not language barriers, but also different cultural understandings of medicine, both from the providers treating them and from the patients. And so I have spent a lot of my career trying to address these issues, including getting a master's of public health within my time in medical school as well.
Excellent. Dr. Gaskill?
So I started working in sub-Saharan Africa as an undergraduate doing various projects, and during my surgical residency, did a 2-year fellowship where one of the years was spent as an NIH Fogarty Fellow in Ghana. While I was there, I was focused on the treatment of trauma and looking at trauma systems for patients, specifically their surgery needs, and kind of at the same time was recognizing that there's a huge um, influx of cancer patients. And as the global burden of disease was shifting from other non-communicable diseases to cancer, recognized that there's a huge need for cancer care capacity, at least in the areas I was working. So that really led me to my interest in cancer and cancer surgery overall. And so from there, I went on to do a surgical oncology fellowship and really start to dive into how to increase the ability to care for cancer patients in low resource settings.
Because the program is just emerging, what are some of your goals and objectives that you have while developing this?
One of our main goals is really to bring people together, different providers within the health system. I think that there are many people doing work globally, both here at the Cancer Center and then also with partners around the world. And a lot of us to this point have been working within our own departments, our own divisions. And I think there's really an opportunity to collaborate and learn from each other and to really join forces and try to improve care, not only for our very diverse patient population here, but also globally.
So it's going to be like the UN of cancer centers, right? I mean, you're bringing together. Would you also be, let's say, having, partners in other countries who are physicians, maybe with a similar specialty that we could learn from?
So I think it's less of a UN and more of building collaborations. And so not just bi-directional collaborations where UC Davis is working in a silo with another institution or another partnership, but being a place where multiple parties from different areas and different interests can come together and start tackling common problems. And so, in global health, we look at this idea of not just bidirectional but tridirectional, where we're connecting maybe some surgeons in Cote d'Ivoire to surgeons in Tanzania who are dealing with similar things on different levels, and they're able to collaborate and use us as a resource for other expertise, and even outside of the discipline, looking at biostatisticians who have an expertise in that, who are necessary for the research in different countries, and they can then bring in more expertise and make the research platforms better and more sustainable.
This is not like Doctors Without Borders. This is more of an opportunity to partner outside of the U.S. with like-minded specialists, MDs.
Yeah, I think that the basis of all of our work is really rooted in partnerships and relationships. And that's why a lot of these programs take longer than your typical scientific endeavor, because it's about building trust and about really understanding the stakeholders and their concerns and their interests and what they want to move forward, and then figuring out ways that we can be collaborative together, building on what the needs are. Out of those initial relationships, you build true collaborations and partnerships with other institutions. But at the very bottom of everything is a friendship, and I think that's one of the reasons that I really enjoy the work we do, is it's not just about the work, it's about the people that were involved. And in terms of, looking at how those collaborations are built, it's not a one-way street. And I think, that's maybe evolved over time with, the history of global health in general, but it's not just, UC Davis providing, care, resources, et cetera, to our collaborators. It's also, them providing insight and knowledge and experience to us. For one example, we have a great new immigrant population from the Middle East in Sacramento area. And with that, not necessarily cancer, but is a complex liver disease called Haddad cyst or gonococcal cyst. Our experience in the U.S. is pretty junior, pretty limited. And it's something that a lot of our medical students read about in textbooks, but you don't see in your training. Contrast that to my colleagues in India and in Tanzania and elsewhere. They see this all the time. And so when we started seeing these patients come over and present at the UC Davis Cancer Center, first thing I did was call my collaborators from other countries and see, they're experts. They see, these very frequently and ask for their method of approaching them and their way of doing things and how I could modify that to our environment, the constraints and the benefits of our environment.
Would it be sort of like an international tumor board? I mean, how do you see the infrastructure being established?
So that's a separate project. So actually in Tanzania, we are creating an international tumor board for liver cancers. And so, what we do is it's held every Friday morning their time. It's Thursday night at about 10 o'clock our time. And we log in and we review cases, and we have people coming from Egypt and people coming from other parts of the U.S. It's multidisciplinary, so we have just surgeons and IR doctor, interventional radiologists, and hepatologists. Everyone's coming in to look at these cases. And I think we want to build this to the point that we're bringing our own trainees along too, because these cases are not things that we see in our practice, and they require a huge amount of expertise that our attendees may not be able to deliver, and vice versa. There's also things that we can help with, and that we do have maybe a little bit more expertise in and can provide some guidance. And I think it also gives the opportunity for weekly meetings where you're again building those relationships. There's someone who everyone feels like they can call a friend to help. And you're opening the minds of different people to new solutions to the problems we're all facing.
Yeah, that's really great, especially as the world gets smaller and we see more and more people coming from different regions or moving to different regions. It allows you to just treat them even though you may not be familiar with their affliction because you have experts and colleagues and friends in the other areas. Well, you've mentioned a couple of countries already. How many countries or which countries do you foresee working with, or is it truly you would like to have everybody involved in the long term?
My work has mostly been within Latin America and more specifically within Central America. And speaking to what Dr. Gaskill had said, it's really about friendship at the beginning and at the end and in the middle of all of it. And I started as a fellow wanting to look at adolescent and young adult cancer and looking at what the different barriers to care were for these patients. And so from that, we started doing work looking at what the barriers to care were. And now in the Dominican Republic, they presented a proposal for the first AYA program to the First Lady in the Ministry of Health. It took about 8 years, but those are things where you can create change, I think, at that level when you really put this time and work and partnership together. So that's mostly where I've been focused on, but we do also have a global AYA working group that's out of one of our pediatric specialty societies, and so I do interact with colleagues basically from all over the world. And I know Dr. Gaskill works in some similar areas in Latin America, but other countries as well.
What do your patients say when they realize that, we are putting this amount of effort into understanding their disease and consulting with specialists in their own, native countries? They must feel so grateful.
One thing I do is research and partnership with these physicians out of the needs that they have addressed that they have with adolescents, young adults with cancer in their countries. But recently, these partnerships and friendships have become very important when we've had patients who have wanted to actually go back to their home countries. And I've been able to literally send a WhatsApp message and have a physician who is willing to take them and take care of them. And that recently, I think, has been one of the most important things for me that has come out of all of this work that's directly impacted the patients we've taken care of here.
That must be so rewarding, Dr. Alvarez.
It is. It's very nice to have people ask you if you know somebody and be able to say I do, and I know they'll be taken care of.
Dr. Gaskill, you had some stories along those lines?
Yeah, cancer knows no, borders. And what we're seeing in, one of the great things about UC Davis is we get the chance to take care of a very diverse population. The largest immigrant population to California is from Central America, and Central America happens to be the highest hotspot, the highest incidence area for gastric cancer. And so we have projects down in Honduras and El Salvador looking at ways to increase gastric cancer capacity and treatment, mostly diagnosis at this point. But one of the great things is being able to take care of patients, on both sides of that border with the same disease, and then really understanding how that disease is different based on where that person lives. One of the really interesting things, or one of the really rewarding things that I've gotten to experience lately was I just took care of a patient from Nicaragua who lives in Sacramento part-time and had gastric cancer. We treated them with chemotherapy, then surgery, and after surgery, he was really excited to be able to tell his story and uh, to tell other people from his area, from Central America, that gastric cancer is a big problem among those people, and that they should be thinking about that when they have affliction, and also how can we create literature to make it a more approachable disease for those folks. And so one of the things that we've been talking about is after we remove your stomach, you need to eat differently for a little bit as your body learns to eat again without a stomach. And while we do a great job preparing patients for that, we often just talk about foods that are maybe not necessarily culturally something that they eat a lot of. And so he'd like to make a cookbook, for instance, using his own normal foods that his family eats on a routine basis, and go through them and look at which of those foods is good to eat immediately post-op and which foods we should graduate to over time. It's things like that that make this disease, make our ability to treat this disease in different cultures a little easier. And not to mention, what can we learn from treating patients in both of those environments? And are there different medications that may work better? Are there different ways of screening that we should be employing? And how can we study that in a way that's gonna benefit both populations?
And prevention as well, I would imagine. How we outreach to certain populations, we could learn perhaps from their native countries.
Yeah, absolutely.
Bottom line, what do we want success to look like when it comes to global oncology?
The success of these programs is really to build the capacity so that we're continuously graduating to the next step. So cancer care in America, right? We're still striving to find better treatments, better diagnostics, earlier detection, all of that. And that's the same goal internationally. In low and middle income countries. It's just, we're at different levels. And so, oftentimes we talk about, okay, well, so let's say we increase our ability to treat gastric cancer to the point of America in Honduras. That's great. But we still have room to go here too. And so it's continuously looking at how to make cancer care better, regardless of where someone lives, what access to care they have, and what disease they're presenting with.
Well, and is there anything else that we have missed or that you feel that is important for our listeners to know?
We would love to get more people involved. So we really welcome anybody reaching out to us that's interested in working within this space, not just doctors, our whole health system.
It's truly multidisciplinary. We're holding our first seminar on global oncology with the Cancer Center in the next few weeks. We've are trying to invite everyone who has an interest to come and join join the discussion and learn from what people are doing, kind of independently, and find new areas for collaboration within UC Davis. Hoping to eventually, link those relationships that each of us have built, so that we can start to create cross collaborations between different sites abroad and within the UC system.
We'll also be sure to include the contact information within the description of the podcast. So if anybody would like to reach out, learn more information, collaborate within this, you'll have that information there as well. Well, thank you for joining us, Dr. Alvarez, Dr. Gaskill, and thank you for tuning in and listening today. If you'd like to get in touch with us, you can email us directly at beatcancer@ucdavis.edu. Beat Cancer is a production of the UC Davis Comprehensive Cancer Center. For more information on our NCI-designated Comprehensive Cancer Center, please visit health.ucdavis.edu/cancer.